So we're going to do a stretching exercise for your thoracic kyphosis. So what we're going to do is start in this position with our hands behind our head. Perfect. And then you're going to slowly open up, arching your upper back and bringing your elbows back and your shoulder blades together. Perfect. And how does that feel?
Good.
All right. And then if you take a breath in, you can further the stretch and then exhale and come back down and then inhale and open back up. Really feeling that stretch in your chest. Perfect. And then feeling in the back, you should feel a tightness, a pulling. Perfect. And come back down. And how does that feel?
Good.
Good. And continue doing that. So if you're focusing on stretching the front structures, you're going to do it 3 times for 30 seconds each time. If you're focusing on strengthening your back structures, you're going to do it 3 times for 10 repetitions. All right?
Okay.
The next exercise we're going to do is also aimed at correcting your thoracic kyphosis. So what you're going to do is basically you're going to make a Y shape, and we're going to make sure that our thumbs are up when we're doing that. So if you want to extend your arms out in front of you, perfect. And then what you're going to do is raise both your arms up to about that height. Great. And then back down and back up. Perfect. And back down. Good. Is that all right?
Yep.
All right, continue. And you're going to do this for 3 sets for 10 repetitions. The next thing we're going to do for managing our patient's lower back pain is some manual lumbar traction. So what we're going to do is have the patient lying prone, have them go ahead and hook up on top of the table here so that we aren't able to move you. Good. And then ideally we would like to have the patient's ankles hanging off the edge of the table, but we don't have that kind of setup here. So I'm going to take the towel, drape it over top of my patient's ankles, bring this underneath, bring this underneath. All right, everything okay?
Yep.
And does this feel comfortable?
Yep.
Perfect. I'm going to place my foot here, and I'm going to make sure my back isn't bent, and I'm just going to gradually apply a traction force as I extend her hips. Good, everything all right?
Yep.
All right, and so we're just going to hold this for a couple seconds, allowing that nuclear material to centralize inside the disc, and then we're going to slowly release it back. Perfect. Everything all right?
Yep.
And now during this time, we could potentially have our patient doing some prone press-ups and some things during this rest time, but otherwise we can continue doing traction. So we'll do this a couple times for a couple seconds each time, allowing the nuclear material to centralize in the disc. All right.
Yep.
And releasing. All right, everything okay?
Yep.
Good. Our next patient has an upslipped right innominate. So what we're going to do is a muscle energy technique to hopefully bring that innominate back down inferiorly. So what we're going to do is have the patient lying supine. We're going to have the uninvolved side just supported by the table, and we're going to take the involved side. And one source was saying to flex, and another source, the book, was saying to extend. But the main thing we really want to focus on is ensuring that we have some internal rotation here. So what we're going to do is, once we're internally rotated and the patient is comfortable, everything all right?
Yep.
We're going to apply a slight traction force. And before I do that, what I'm going to have the patient do is just hike the involved hip up. So if you could just do that once just to make sure you know how to do it, perfect, just like that. So once I apply this traction, we're going to have you do that again internally rotated, and just gradually pulling. All right, and if you can go ahead and contract that quadratus lumborum, perfect. Perfect. And we're going to hold this for about 10 seconds. Contract, contract, and then release. And then we're going to pull a little bit more just to hopefully bring that innominate down now that the QL, the muscle that may be holding it up superiorly, is a little relaxed. And we're going to release, and I'm going to have you contract again. So Perfect. All right, we're gonna hold it for 10 seconds, and we're gonna do this 3 times. And release. Perfect. Is that all right? Everything feel okay?
Yep.
All right, and last time, hike it up. All right. And relax. Good. How's that feel?
Good.
Okay. What we're going to do next is a scalene stretch on the right side. So I'm going to passively put the patient into that position first, just so they're aware of the position they're going into, and then I'm going to have the patient do it on their own and apply a little bit of overpressure. So what you're going to do is just extend, and we're stretching the scalenes on the right side. So we're going to have you side bend to the left, and then you're going to rotate towards the tight side. Perfect, just like that. All right, and do you feel a stretch?
Mm-hmm.
Is it comfortable?
Mm-hmm.
All right, so we're gonna hold this for 30 seconds 3 times, and then another thing I want you to do is grab the bench to your right. Perfect. So, all right, I'm gonna let you go back into position. All right, and then let me see you do that on your own. So we're gonna extend, side bend away, and then rotate towards. Perfect. And then using your other hand here, you can just gradually put a little bit of overpressure. Perfect. And do you feel it stretching right in here?
Mm-hmm.
Awesome. And again, you're going to hold that for 30 seconds 3 times. Next, we have a patient who has a disc herniation posteriorly in her lumbar. So what we're going to do is a low-level exercise that's going to help facilitate extension and hopefully push some of that nuclear material back anteriorly. So what we're going to do is have our patient starting in prone, and everything all right. And for patients with low back pain, especially with the herniation posteriorly, extension can be quite painful sometimes. So we're going to do this very slowly and gradually. So from this position, all I'm going to have you do is just get up onto your forearms, just very slowly. All right, is that okay?
Yeah.
All right, everything feel all right?
Mm-hmm.
And then you can come back down. Perfect, everything okay?
Yep.
All right, and then let's go ahead and do the same thing but onto your hands. And slowly. Perfect. And back down. All right, and up again. And back down. And ideally, going up into extension, back up again, is going to be forcing that nuclear material back anteriorly out of the posterior protrusion. And back down. All right, and up again. And again, we're going to be doing this about 3 sets for 10 repetitions. Next, we are going to do a high-level abdominal exercise for strengthening and stabilization. So this is a high-level exercise, so it's not for beginners. We're going to have the patient lying prone initially. Perfect. And then we're going to ask the patient to get up onto her toes and onto her forearms, taking out the curvature of her lumbar spine, so essentially contracting her abdominals to bring her pubis to her sternum. Perfect, and it's nice and rounded there. Everything all right?
Yep.
Everything comfortable? Perfect. So we're going to hold this for about 30 seconds to a minute. You can go ahead and relax. And then we're going to do that a couple more times, so 3 times. Once they do achieve a minute in length, then we can progress the exercise to make it a little bit more difficult. So something that we can do with this exercise, if you want to go back up into that plank position, we can progress up to our hands from our forearms. Perfect. And then from here we can make it even more challenging by raising this arm up. Awesome. Arm down, or raising a leg up. Awesome. Leg down, or raising a leg and an arm at the same time. Perfect. Neck down. Everything all right?
Yep.
And again, we're going to be doing those for about 30 seconds to a minute for 3 times each.